Hi there, everybody. This is Carrie Hamblen, the CEO and president of the Las Cruces Green Chamber of Commerce, coming to you again with another Zoom chat that is a benefit for our member businesses of the Las Cruces Green Chamber of Commerce. And they're just wonderful opportunities to have like really short conversations with our members and kind of highlight what they're doing in the community. And today I have back with me again, because it's been quite a while, is Maria Laquerre Diego from A New Hope Therapy Center. Maria, it is so good seeing you. How are
I
you
know.
doing?
I'm doing all right. It's been a while, but we've been busy. So yeah, it's
Yeah.
been a minute.
Yeah, it has been a while. And, today we've got this video going out because May is Mental Health Awareness Month. And
Yes.
so since the time that we've spoken, um, how has work been for you? Because I can kind of imagine it's been a little busy.
Yeah, it's definitely been busy. We've seen an increased need, for mental health services, kind of across the board. Our kids, our teens, our adults, our relationships. The last 2 years have really started to take a toll now that things are slowly kind of migrating back to where we can be out and about and have people over and see people and travel. It's really started to come up, some of those losses, some of those changes that we've seen. So it's definitely been, more people reaching out, which is fantastic. People recognizing that they need that support, and just kind of an increase of familiarity, right? So we're really familiar with Zoom now.
Yeah.
And I think that helps too. People are really open to doing telehealth services, which is just video chatting with a therapist. And that's been nice because our reach just down here in Cruces goes all the way up through Tatch and Deming over to kind of Theo and Santa Teresa. Like we kind of encapsulate, we have people that we serve out from Alamogordo and Ruidoso that they don't have to travel now to see the therapist that they want to see. They can just do it from home. So it's been busy.
Yeah, well, and it's good. I mean, we can talk about accessibility to broadband and how really grateful we are, that people are able to do that. And I'm sure a lot of
Mhm.
people do it from their phones as well, which makes it a little bit more
Absolutely.
accessible. And and we would think, I think a lot of people were thinking, okay, gosh, once this is over, then my life will get back to whatever it was in terms of normalcy. And
Mhm.
in some cases, that normalcy is not necessarily the most healthy. In other cases, it is. But people are like longing for what we know.
Yeah.
But it's what we know is not the same before the pandemic. It's different
No,
now, right?
yeah, and I don't know that we're gonna go back. I think so much has changed. We've experienced so much that was brand new to us. It's changed the way we've done school. It's changed the way we've worked. It's changed our relationships. And I don't think we're going to go back. I think we might find some comfort in some things that are a little bit more familiar than scary. But I don't see us going backwards, which in my practice is a really good thing. That means we can help more people that don't need to worry about transportation issues, or we help a lot of professionals on their lunch break. They can just close their door to their office, hop on their phone or their computer and chat with a professional to kind of get them through the week. And so that's not too bad. But yeah, I think you're right. I think a lot of us were waiting for it to like just snap back to being
Yep.
back to normal, and it's not coming. It's not coming. And I think some people are starting to realize that.
Well, and you talk a lot about like, from a business perspective on like really kind of modifying how you're offering your services
Mhm.
and being able to be flexible for that. A lot of businesses aren't. And they're gonna hurt for it. So I'm really glad that you're able to kind of like modify or pivot, which is like apparently like the word that
Right?
people. I mean, I like to use adapt.
Well, that
Or
doesn't bring up images of Ross from Friends, right? But pivot.
exactly. How many people? Yeah, the fact that you just got that is like pivot. I mean, if you don't know what we're talking about, Google Pivot and Friends,
Yep.
because it
Yourself.
was like one of the most iconic episodes of Friends, and we just dated ourselves totally.
I know. That's fine.
Yeah,
I'm
it's okay.
graced with age.
Yes, exactly. Well, and so we talk about like mental health awareness month, and I personally feel that we should be recognizing it every day and talking about it and destigmatizing it and making it to where access to mental health services is easier for people. And in part, you're experiencing that where more and more people are doing this. But before we started recording, I talked to you about a young person that I met, who's really worried about having an episode because of their diagnosis, and you had mentioned that you're able to get into the schools a little bit more. And
Yeah.
are you seeing, like, with young people, are you seeing them having a harder time right now? And
Yeah, absolutely. Absolutely. I think there's a lot of factors to that. But yeah, we've partnered up with a couple of charter schools here in town whose social workers reached out because it exceeded their capacity. One social worker for a whole school of kids is just not enough. So once a week, we have our clinicians that go out there and we provide individual services for their kids right there at their school so that they're not missing anything. We also do like family work with them, also either through Zoom or right there at the school. Yeah, we know across our whole community, our kids are struggling. They've had to adapt to so many things. Social media is always a double-edged sword. It's nice to have connections with other people, but then they're also being exposed to things that maybe they should be to, or are learning maladaptive behaviors, as we would say. But yeah, our kids are struggling. The pandemic has not been easy on anyone.
yeah.
And I think our kids for sure have taken a big brunt of that.
Yeah. Well, and destigmatizing it, because for so many people, and especially, gosh, and like when we were kids, we were talking about this, that, if there were mental health issues in your family, you didn't talk about it.
Yeah.
And so when we talk about destigmatizing it, first and foremost, it's talking about it more and not shaming it, and recognizing that it's people's body chemistry, it's their trauma experiences, it's whatever has shaped who they are at this moment. How else can we destigmatize mental illness so that people feel safe and supported to be able to get the help they need and that they deserve?
Oh, absolutely. I think everyone deserves to have, mental health and to have that support that they need in any aspect of their life. So we work really hard to destigmatize mental health. One, like you're saying, just talk about it. Just kind of keep putting it out there. I mean, it's what we do. So of course, it's what I talk about all day. But for example, a small group of us were just down in El Paso at El Paso Comic-Con, and we held 2 panels about geek therapy and understanding the psychology of villains. And it was fantastic. It was really cool. And that's a venue that you wouldn't expect to see therapists pop up, but geek therapy is a real thing. And it's nice to let them know, like, hey, we're geeks and we're professionals. So you can kind of find a therapist that fits your vibe, and maybe kind of geek out about similar things, whether it's friends or whatever the case might be.
Star Wars, because I see a Darth Vader there.
Oh yeah. My friends over there in the corner. Yeah, and so looking for those other outlets where you wouldn't think mental health would be popping up, but it's there. Mental health is everywhere.
Right.
And so part of what we're trying to do is to go to those places and destigmatize it by just kind of showing up in cosplay and talking about mental health, which combine the two of my things, like that's
well, I mean, and I think we could talk about cosplay a lot, because in a whole nother episode, because cosplay is really an opportunity for people to kind of get outside of themselves and be somebody else and feel really comfortable. And you see, my godson is a furry, and he and so we found that he, like, his mom and I are like longtime high school friends, and he's found his people, and it's so lovely to see, and he's just blossoming, and it's just and so it is like it's like finding your people, finding people that you feel safe with, and then kind of going into these different areas that we normally we'd normally think that, like, people who are depressed or having anxiety are people in high stress jobs, and the big corporate crap that we see. But the thing is that everybody's got their stuff, and it doesn't matter what you do for a living. It's like just looking at your different areas of interest and kind of like meeting people where they are.
Absolutely. And trying to debunk what therapy used to be seen as, right? We talk about our offices, and this is my home office, but I in at my other office, I have lightsabers and I have costumes and capes and I have figures from different, pop culture references. It looks more like a living room than it does like a clinic, because when people used to talk about therapy, it was like Freudian based, right? Like lie on the couch and tell me about your relationship with your mom. And that's not what we do. We play video games in our therapy sessions. We have therapeutic Dungeons and Dragon groups. It doesn't have to look like it does in the movies or, in those old representations, and just trying to break those barriers down. But also just recognizing that therapists are people. We're geeks and nerds and we're into things. And sometimes that helps because it's more like talking to a friend for some support advice rather than someone who has all the answers, because we don't. We don't have a magic book of answers. But what we do have is support and education and tools to help you get to where you want to be.
Well, and it's interesting because, there are many therapists. I've been a strong proponent of therapy. I've had therapy in different times of my life when I've needed it, because I've needed those tools to kind of, learn how to address certain issues that were happening. And I'm grateful for that toolbox that I've got. And every once in a while I have to revisit that toolbox, and I'm grateful. But the thing is that it's interesting because you're comfortable in disclosing more about yourself than most people. I think there are therapists who are certainly like, we have to maintain this line. But I think that's also kind of a different way of training. And the people were trained, and so. One of the hardest things for people with mental illness is to take that first step and ask for help. And so, and it's also sometimes hard to find a therapist. That's the big thing right now. It's access to therapy. And so, thankfully, because of telehealth, people are having more, at least a little bit fewer barriers to trying to find, a mental health provider. But what are kind of like, what you would recommend if somebody is at that point where they're like, I'm not in a good space. I am not able to do the things that I need to do, either get up out of bed, clean my house, take care of myself, shower, which are all very common symptoms of depression.
Absolutely.
When somebody gets to that point, it's really hard to kind of force that point if you're somebody from the outside, so you just kind of have to sit and wait. When that person is ready, what do you recommend that they do when they're ready, when they realize, okay, I'm not something I can do on my own?
Yeah, absolutely. I think first I'd want to make sure that they knew that they're not alone. They are absolutely not alone, even when they think like there's no one who in this world who's experiencing what I'm experiencing. You're not alone in that. And that there is help available. Yes, there might be a little bit of a wait, unfortunately, and there, we're trying to reduce as many barriers as possible. But I think the first thing you need to do is just reach out. And if you can't reach out to a therapist directly, reaching out to like a trusted loved one to say like, I can't do this anymore. I need that help. And having them help find a provider for you. It's as easy as Googling. You can ask Siri to find you a therapist. We try to make ourselves really accessible and out there. And I had a really good colleague just tell me this weekend, because, you mentioned it might take a minute to get in, but it also might take a minute to find a good match. Not every therapist is right for every person and vice versa. And my colleague had said, how much time and consideration we take into finding like a hairstylist that's not gonna like jack this up, right? We should be doing the same with our mental health provider. If you go to the first one and it is not a good experience for whatever reason, don't stop. Find another one, because we are all vastly different, and that relationship is the key. So you need to find someone that you connect with, whether it's around geekdom, whether it's around just that relationship that you feel heard is really what you need to find. So if you make an appointment and you don't walk away feeling a little bit better and a little bit heard, keep trying. Try another provider, because that relationship match is the most important piece. But yeah, I would say you're not alone. There is somebody who wants to help you and who's willing to help you. And just, if you can't make that first step, ask someone to help and hold your hand to make that first step.
And there are people who are wanting to do that, you know.
Absolutely.
Yeah.
Absolutely. And for us, I mean, you know, so we know phone calls can be really anxiety producing for a lot of people. So on our website, you can even just fill out a form. You don't have to talk to anybody before you talk to your therapist if you don't want to. All of our forms are online. You can do everything kind of behind the screen until you have to meet with your therapist.
Right.
So in any way that we can make that easier, you know, we've had concerned parents call for adult children, and you know, we need that consent from that adult child, but everything else we can do and try to support them and make it as easy as possible.
Yeah, and sometimes that you know, especially when it comes down to you know, trying to find the right fit, and you know, for folks who are in crisis, you know, it's kind of exhausting to go, well, if that one didn't work, you know, I just, it's not going to happen. I'm not going to be able to find anybody. And so like the most energy that you can muster should be going toward that at that moment, is like trying to find somebody who can help you, because then you get the tools, then you get the explanations, you get kind of reassurance, you get confirmation. You know, it's so important. And so you know, I'm so glad that you're out there and that you're doing things and that you're working with kids and that you're able to get into the schools, and that you're a self-admitted geek who loves Star Wars and Friends and pop culture. There's a really good podcast called Pop Culture Happy Hour. I'd recommend that you listen to.
All right, I'll put it on my list.
And so, Maria, thank you so much. And we're going to be sharing some of your information throughout the month, because May is Mental Health Awareness Month. And so we want to make sure that if you are experiencing a crisis or just need somebody to kind of help, like bounce things off of, to get those tools in your toolkit, or if you know somebody who does, the first step is always getting help, because that road is some of the hardest work you'll ever do, but it's going to be some of the most rewarding work that you're ever going to do. And once you get on the other side, and there is another side, once you get on the other side, you'll be really grateful that you did. So thank you, Maria, and thank you for all the work that you're doing. And this will not air on May the 4th. This is we're having this come out today on May 2nd. But as somebody who has a little bit of geekdom, May the 4th be with you as well.
Thank you.
Yes. And so if you'd like more information on A New Hope Therapy Center, how to get in touch with Maria and her crew, information is above or below, all depending on how you're looking at it. If you're a member business of the Green Chamber and want to do a Zoom chat so we can uplift you in one of our Zoom chats, you can contact me here on our Facebook page, and I'll be more than happy to schedule that, because we're having a lot of fun with these. So Maria, thank you so much. I will be hopefully seeing you in person soon. And otherwise, you know, thank you for all that you're doing. I'm so grateful for you and for your crew who are doing things that are helping a lot of people.
Likewise, Carrie. Thanks for helping us celebrate May.
Absolutely. All right.
Bye.
Bye.